What is the essential belief and ideology of psychotherapy?
Psychotherapy is the treatment of a mental disorder through psychological means rather than through medical means. Its goal is to help patients develop healthier, more effective habits to lead fulfilling lives. Psychotherapy is a collaborative treatment based on the relationship between an individual and a psychologist. Grounded in dialogue, it provides a supportive environment that allows for open talk with someone who's objective, neutral, and non-judgmental. The psychodynamic approach, which was developed by Sigmund Freud, assumes that behavior and feelings are affected by unconscious motives, and that behavior and feelings in adults are rooted in childhood experiences. The psychodynamic approach includes all the theories in psychology that see human functioning based upon the interaction of drives and forces within the person, particularly unconscious, and between the different structures of the personality, known as the id, ego, and the superego. The psychodynamic therapist usually treats depression and anxiety-related disorders, though this school of thought has fallen out of popularity since the 20th century.
Existential humanistic therapy emerged as a response to psychodynamic treatments in an effort to focus more on the present and future than the past and any traumas which may stem from them. Existential and humanistic therapies are both derived from the belief that people have a capacity for self-awareness and make choices freely. Whereas the humanistic perspective views people as inherently good and rational, the existential perspective focuses on anxieties over loneliness, hopelessness, despair, and death, which are believed to be the root of most, if not all, problems. While a humanistic therapist tries to create a therapeutic relationship that is warm and accepting and that trusts the client's inner drive is to actualize in a healthy direction. The existential therapist recognizes that human influence is shaped by biology, culture, and luck, and that the personal problems come from not exercising choice and judgment enough.
As a result of studying psychoanalysis and depression, Dr. Aaron T. Beck developed both cognitive and behavioral therapy. Cognitive dealing with how we feel in response to how we think, and behavioral therapy dealing with how we act in response to how we think. Within a behavioral therapeutic session, instead of prescribing medication to treat the patient's mental condition, the psychologist will instead assign a task where the client must then monitor their daily routine. Going based off of the routine is where some modifications are to be made, either to increase their social interactions or allow them to have a more positive outlook on themselves. Say if after finishing work at 4 p.m., one were to binge watch Grey's Anatomy up until midnight every day, they would find themselves having non-productive days either because they're antisocial, depressed, or have a negative outlook on life. Cognitive therapy aids the client by allowing them to see an alternative way to view certain situations in hopes of eventually changing how they will feel afterwards. In most cases, people who seek cognitive-based therapy have trouble understanding the situations they are placed into and why.
Why is psychotherapy effective for some patients and not others? Is it related to a dysfunction in the relationship between the patient and psychologist?